So labor was actually really fast.
Oh my
From
gosh.
8:30 was my first contraction of the day, and he was born at 3:30.
Wow. That
So
was
it wasn't
so
as
fast.
fast as Quentin, who was
Right.
like 3 hours, but the transition, like the labor
Yeah.
progression, was really smooth and.
Oh my gosh.
and
What a
it
blessing.
Needed, yeah, it was perfect timing too, because we were already in Santa Clarita.
What a blessing.
So we just drove straight to the birth center.
Yeah, I got the message like we're going to the birth center, and I was like, oh, the baby's here. I was like, wait.
It was
how fast
really
is that?
fast. He was
That's
born in
incredible.
water.
Awesome.
So we did have a water birth with him.
Aww.
But my water broke before, and that's never really happened before.
Okay. The baby was like ready. It's
He
like
was,
tense
but
going.
then he wasn't, because
Got
he was
it.
like, didn't really want to,
Yeah,
to function.
Right.
He was like, oh man.
Yeah, that's okay. God likes to keep it unique sometimes, you know.
Oh, it's been such a unique journey with him.
I love it.
It's been, completely
Aww.
unique, so new. Might as well be a first time mom,
Yeah.
because there's been just so much new experiences with
Mm-hmm.
him.
So you mentioned that he's like having, like, you just wanted to make sure he's gaining weight, and that he's drinking milk properly.
He wasn't transferring enough milk. He would just get too sleepy.
Ah.
So we started supplementing with bottle with express milk after nursing, and then when we need to, formula.
Got it.
Just to help him get back to where he needs to be.
Yeah. So what I'm doing is just, as I'm holding him here, I'm just feeling his spine and finding like restrictions in his joints, and you can kind of see how his belly's like rising as I press on his back gently.
Yeah.
So the restrictions I feel are in the more common areas, which is in the neck and then the low back area.
Okay.
So anything in the low back is digestion. Anything in the upper back neck area is more of like him just trying to intake the food and milk. So if we can get those restrictions out of him, which they're slowly going away as I palpate more and go back to the same spot again, it actually treats itself. Like that's the adjustment. It's so light and gentle with them, and until those restrictions are gone. And so that's just trying to help open up the nervous system so the brain and the body can communicate properly, and then hopefully his issues will be resolved. Yeah.
He did see a craniosacral therapist yesterday.
No way.
And she actually had some really good releases with him.
Wow.
Like his whole little legs like started shaking during the first release. I was like, wow, that's. Have you seen videos of like adults?
Yeah.
And I was like, oh, they're faking it.
Oh, right.
I was like, oh, actually, I guess it's not fake. I've never seen a release like that.
That's incredible. Yeah, like I said, I'm barely, like I'll go back and reassess and it's gone. Like the restriction I felt is like not there because the actual palpation was the treatment and it got the joints to release.
Yay.
Yeah.
So hopefully.
So even right now, like in the neck, I'm just like feeling it like let go. So that's all it is. Yeah, it's just
so relaxing.
Yeah. It's the music.
He's like a really chill baby.
He
This
is a chill
how
baby.
He is.
He is. He's so chill. So how big was he? What was
He was
his?
5 pounds 11 ounces.
Okay.
So the issue was at his 48-hour appointment, he was 5'3".
Mm-hmm.
So he dropped 8 ounces.
Oh yeah.
And then at his 1 week appointment, he was 5'2". He lost another ounce on their scale.
Oh, okay.
So on his pediatrician scale, he wasn't ever that small. And then our home scale, he wasn't ever that small.
Oh, so he
either.
really wasn't eating probably.
So
or something.
So as soon as we started giving him the bottle,
Okay, let me hand it back to
we
you.
noticed a huge difference
Keep him warm.
in his attitude, his demeanor, his strength, and his jaundice is cleared up.
Aww.
So.
Yeah, no, he's doing great. So there's different ways to treat the baby. So sometimes, I mean, I was able to take care of him as he is, but if he was a little bit bigger, a little bit, so that you just cradle him over your shoulder, and then I'll fill his back and palpate it that way. And then if he's ready for it, rather than just my thumb or my fingers being the adjustment tool, it's an actual adjustment tool that I'll push and click on him to get it to go. But it's very light, very gentle.
Yeah, but I think people think that newborns get adjusted like with cracks.
Oh yeah,
like,
yeah.
no,
If anything, I just held him and that was it, you know, because
it's so gentle.
it's so gentle, so gentle. And there's situations where newborns, have a deformity and they can't move their neck and things like that. but that's more of a medical issue versus a
They
chiropractic.
want his feet looked at because like
Mhm.
they think like he had him in a weird position in the womb.
Oh.
So they want to double check that like his feet are
Yeah,
normal.
absolutely. Of course.
They're
of course.
huge.
They're great. You
They
got
were
some.
pretty much like
you got
he
some-
was pressed against his shin.
Yeah, like he was able to
Like
bend his.
full flexion like that.
Yeah.
Oh, it was like all the way.
Mhm.
Oh yeah. Gotcha.
So they just want to make sure
Oh yeah.
his little feet are normal.
Yeah.
Even though they're massive.
You got those basketball feet ready to grip the court. So the beauty of children is that their bones are cartilage when they're this age. They're not
Okay.
hard. They're designed to be very flexible. You can almost bounce them like a basketball. I wouldn't recommend it, but you could. And that's all for the purpose of to like travel through the birth canal and just be born, you know. So you got to kind of squish through there somehow,
Yeah.
you know. But for it to be that flexible, I'm not too concerned about it.
Okay.
But I'll keep an eye on it as he gets bigger.
Okay.
So usually with children his age, I would say, you know, bring them in. It could be every 6 months or every 6 weeks, just
Okay.
depending on how concerned you are with certain things that are going on. We did adjust him. He moved well. If he didn't, I would like to see him sooner. But everything checks out great. Yeah,
Awesome.
just holding his back and
And
taking
his
care
head.
of it. Yes,
His head.
yes, he's
I
beautiful.
know like
head.
everyone.
And so we just check the fontanelles and see where the dips are, and just make sure things are lined up properly here. And if we feel a joint out of place, these are joints still, they haven't fused yet, then we just hold them and kind of gently put pressure into alignment, if that makes sense. So I'm using kind of like my right knuckle here to put pressure this way and just kind of line that part of his skull.
That's
And you
so-
just hold it just for about a minute or so, yeah. And there's situations where, you know, the baby's head circumference isn't where
Mhm.
mothers prefer it to be, you know? And there's no internal damage, like their brain's gonna be fine and everything, but it's just, you know.
Oh, when they come out with like a cone head.
Yeah, so then they have these helmets that they have them wear and stuff. And there's physical therapists that can treat them. But as a chiro, we just kind of hold on to them and just put things back in place the best way we can, wherever we feel the tension or discomfort. Yeah. But he's so gentle. He's so cute. I love him so much.
He's so little.
Yeah.
He's so chill.
Yeah, he is a chill baby. I mean, there's I'm surprised he's not like trying to fight me right now. You know what I mean? Like
He's so chill.
there's times when the babies are crying and they just want their mommy, and he's just like, I'm good. Yeah. So for me, it's more in the back that I feel the kind of the misaligned skull there. So I'm just gonna kind of hold that back in place gently. So I can't see the force I'm applying with the camera, but it's just enough to change the color of my thumb. So like if I put pressure on my thumb and the color on my thumb changes, that's the amount of pressure I'm using. So I'm going this way and going this way just to put things back together here.
At what age do they start fusing?
In the first year, yeah. Within first 9 months, 6 months, they slowly start to fuse. You can still fill it up to a year or two, like the little...
The suture lines?
Exactly. And so as long as they're... And you'll notice, like, oh, maybe I have him on his back too much and his skull's flattening out. Let me get him on his side. Or let me make a little round pillow, like a little cushion for him, like a donut, you know? So he's, like, supported, yeah. But that's it, yeah. So it was a natural birth through with the water and everything? What a blessing.
It was,
yeah, what a blessing.
I think I was in the water for like, 20 minutes? 20
That
minutes
is
and
so
then
nice.
one push and then
Oh my gosh.
he was here.
Yeah. If anything, he felt like he was still in there when he came out.
Yeah. That's what they were saying, just because he was so sleepy and just so slower to rouse, like, you know.
Got it.
He still wanted.
He was still like in.
Yeah, he still wanted to be in the
in
womb.
the yeah, got it.
I'm like, it was
so
your
beautiful.
choice.
Yeah.
You chose. You could have stayed, huh? is
And
this?
part of the history with the babies is the mother. So we always ask, like, well, how was the birthing process? How was he when you were pregnant with him? And that's really his health history. So when they're old enough, and then we can actually talk to the child, we have the parents behind the child, and then we just speak to the child. So just kind of teach them to answer and to be independent.
I know.
And
Did that feel good?
oh, he's so handsome. And there's different reflexes you can check.
Yeah.
You can check on the hand. So you can place them face down, and you just put your finger down their spine and just go like this, and then you'll see if they'll curve, to the right or to the left, Touching their feet. If they do they open up and flare out, or do they kind of clamp down on it? And then same thing with the fingers. They'll just grab onto you.
At what age should we see these reflexes diminishing?
As their nervous system starts to develop, as they start incorporating, moving from an infant into from a newborn to an infant, it's probably within that year. Yeah,
Okay.
I would say so. Everything kind of happens within 9 months to the max 2 years. It's done already. And then another one is just their cheeks. You just kind of touch their cheeks, and then they'll kind of they'll try to go for it. And that's part of the to feed them. So they know.
He definitely has that one.
Yeah. I love it.
Hi.
He looks so good. So sometimes mothers will bring their babies in because they're having an upset stomach or gastritis or just colic. Yeah. And you can see it, their stomach's just risen, like a loaf of bread or something. And it's just really simple how we take care of that. So we just press into the belly, just 1 or 2 fingers, and just kind of move it around into kind of follow the intestines. Just push that gas out. And so it's like clockwork. Just go 1 o'clock, 12 o'clock, and just 11, and just kind of move it circularly. Sometimes they'll bring them in because they're not, drinking, they're not latching on properly, or maybe their head is turned to one side or the other, or they even have an ear infection. And so what we'll do is we'll check the occiput back here. And so I'll just use again my fingers just to reach. Oh, bless you. I'll reach back here in the skull and just kind of feel, which he feels great. I don't feel any restrictions there. But if there was a restriction, then my adjustment would just be literally just doing that gently, just kind of moving it back into place, you could say. And mothers will call me up that day, the next day. Thank you so much for seeing my baby. They pooped. It's a miracle. They're really happy that they're not in pain anymore, and it's the simplest things, but that's all they need. They're just little tiny creatures of love right now, and they don't need much. Just a little bit, and they'll be okay. But
Well, I guess he's an easy patient.
yeah, he's chill. He's awake now.
Yeah. This is what he'll do. He'll just hang out.
It's he'll just be like, "What's going on, Mom? Tell me how your day was."
He'll just watch his brothers and
Yeah.
sisters be crazy.
So since I have him here, I'm gonna check his neck. So I'm gonna go a little lower, and his upper back, and see if that restriction is still there. Yeah, that's gone. And then let me check down here in the low back. Feels good too. Yeah, so he's good. Yeah. So initially there was some restrictions in the upper and lower, and now he feels all the joints are moving like they should. So that's his sign, time to go home, Mom.
Yeah, that was him.
There you go. Yeah. Well, that's how you get them bigger, get them fed, and then the diet that you eat affects him. So if you're on a lot of dairy, he's gonna get a lot of colic. So you want to
try to avoid.
Yeah.
I've been eating so much oatmeal.
Yeah. That's awesome.